Imagine this. You have a kid that comes into your emergency room. Are you able to tell across the room how sick he is? It's hard to do, but I'm going to give you a tool that can do that. It's called the Pediatric Assessment Triangle. This is a very quick, easy thing to be able to look to see across the room and see if that kid is suddenly the sickest kid in your department. There are 3 things to the triangle: the appearance, breathing, and circulation. So we're going to talk about all 3 of those, and then I'm going to give you some examples of what they are, so that way you can be able to feel confident to determine whether your kid is now the sickest kid, especially when you're out in triage. Triage is one of the hardest jobs to do, and you got to make split-second decisions to determine whether that kid is the sickest or not, or if they can wait. So how do you do that? Let's dive into the appearance first. So on appearance, there is a acronym called TICLS, TICLS. In the pediatric world, we love our acronyms. Pediatric Assessment Triangle is one of them, PAT, or the TICLS. So when that kid first walks in, you want to look at their tone. Are they limp? Are they completely flaccid? If they're like that, there's something, big indication that something's wrong. Interactiveness. Are they awake? Are they smiling, looking around at you, looking at everybody else, running around the room? Are they consolable? If a kid is completely irritable, especially those little infants, it's really hard to ask them what's going on because, of course, they don't talk. But can you be able to console the kid if they are super irritable? Can mom console them, or are they just screaming their head off? The other thing is look or gaze. If they are deviating their vision off to one side, just kind of eyeballs are drifting off to one side, or if they are looking at you, are they interacting? Are they looking around? Is their gaze drifting one way or another? And then the other thing to look at for appearance is their speech or cry. Can a kid talk to you? Is a kid crying a lot or not at all? Sometimes there be not crying at all is not necessarily a bad thing, but it can also be a terrible thing as well. So that's for your first part, for the appearance. The next part you're going to be looking at, and again, you haven't even touched your patient yet. You don't know nothing about them. This is they're walking in through the door. Can you look at that kid across the room and be able to determine how sick they are? The next thing is their breathing. Are there audible breath sounds coming at you from across the room? Is there heavy wheezing? Is there stridor like with croup? That one's very easily determined to see like, hey, something's wrong with that kid. I need to do further assessment on them. Positioning. The big one that we see a lot with kids is the tripoding, where they're kind of sitting on the edge of the bed or leaning forward, hunched over, and they're really sucking in a lot of air, trying to open up that airway. So depending on how they're positioning when they're walking in can be huge there. Are they retracting? Are their lungs going in super deep and you're seeing those intercostal muscles, all the accessory muscles being used really hard to try and bring in oxygen into their lungs there. The other one is flaring. This is more common with the infants. Some toddlers can have this as well. You're going to look for the nasal flaring. If they're flaring up their nostrils there, that's a good sign they're trying to get more oxygen into their lungs there. Are they completely apneic? That means they're not breathing at all. That's a bad sign. You need to be rushing them back to your resuscitation room pretty quickly to try and help them. You don't care what's going on. You need to be intervening pretty quickly and going down your ABCs, BLS kind of stuff there. If they're gasping, that's a sign that the kid is about to decompensate really quickly. So that's your air appearance, breathing, and then you've got your circulation is your next one. Looking across the room, is this kid pale? Does he have no color whatsoever to his face? And then that's really hard to tell when you get into some of the racial differences and then you get different skin colors and all that stuff there. But again, you should be able to look across the room and be like, okay, that kid is very pale and doesn't look right. Is there modeling? This kind of shows up as these little purple spots kind of all over. It's kind of hard to explain other than that it just looks off. It doesn't look like your normal pink color. And you should be able to look across the room and be able to determine that, especially in the face. Then there's also the cyanosis, which is blue, and that's a bad sign. That means they're not perfusing well, and you need to intervene pretty quickly. So those are all three that we look at when we're looking at the pediatric assessment triangle. It should be just a very quick across the room as they're walking in. Even if you've got 20 deep waiting to be triaged, you should be able to look and be able to determine who needs to come to you next. And this is a quick, easy tool to be able to use. EMS uses this, ERs across the country use this. It's a great system to be able to use to determine whether your kid is now suddenly the sickest kid that comes walking in through the door. Say, for example, you have a seizure kid that's coming in that is completely limp. They've seized, they're now postictal, they're completely limp, they're blue, and they're mottled. They just suddenly got all three, and they're apneic. They just suddenly got all three points on there between the appearance, the breathing, and the circulation. So it goes, if you get one option, you're sick. If you get the two criteria, you're now sicker. If you have all three, you're the sickest. So depending on, that's kind of the tier. If they have none of them, they're there to be seen. They may just be like an ear infection kind of thing, just be a little irritable, but consolable, things like that. That is your lowest priority. When they have all three of them, that is your highest priority, and that's the ones that you need to be seeing first. This isn't a McDonald's. You can't have come in, first come, first serve kind of thing. It comes in order of acuity, and we know that. And explaining that to other parents and stuff as well kind of helps them understand it too. So let's dive into some examples. For our first example, what do you think about these two kids? Are they sick or not sick? When you first look at them, what are you looking at? Their appearance, right? Appearance, they look happy. They look okay. They're coming, walking in, just high-fiving each other, bouncing off the walls, kind of yelling and screaming, playing. Then you look at their work of breathing. And remember, again, this, you haven't even touched the patient. This is across the room just looking at them. So their work of breathing, they're yelling and screaming, playing, having fun. Great, cool. It hasn't gotten any points yet. They've missed appearance and work of breathing. They all look good. Now their circulation. Do you see any cyanosis, any mottling, any pallor to their skin? No? Cool. So what do you think? Are they sick or not sick? Right? So they're not sick. So these ones can be your lowest acuity. I mean, if you have nobody waiting to be triaged, yeah, you're going to triage them. But if you have another kid coming behind them, you just want to kind of do a quick assessment, across the room assessment there. So example number 2 here. This kid, is he sick or not sick? You have the appearance. He looks like he's feeling pretty crappy. Doesn't feel great. He's kind of breathing, looks like he's breathing hard. So just kind of pulling in some air there. So appearance, he just kind of looks a little tired, a little kind of out of it, but doesn't seem like he's super out of it. So then for work of breathing, he looks like he's kind of pulling in some air and having some retractions there. Then for circulation, he looks a little pale. So then you're kind of like, well, this kid needs a little more assessment there. It gets really difficult when you get those kids that are dramatic and you're not sure as to what's going on with them and stuff. You're like, well, is this kid just being overly dramatic or is this kid actually sick? I find those are the hardest ones to determine on the PAT, especially across the room. So you need to do more assessment on the kid. You need to get the vitals and then get more of a history to see what's going on there. So for this kid, do you think he's sick or not sick? Right? He's sick, but we need more. So is he sick, sicker, or sickest? I would argue either way. He could be either sicker or sickest. Just depends on how he does coming when he's walking in. His appearance, he's kind of tired. He doesn't look super great. His work of breathing, he's got some retractions in there. You can see on his neck muscles there that he's kind of pulling in there a little bit. And then for his circulation, he does look a little pale to me there. Good job. All right. Now for the final example here. Ooh, this kid doesn't look super great here. So is he sick or not sick? Right. He is sick. He's got all three. His appearance, he's pale. He's listless. Well, circulation would be as pale. But his appearance, he's just kind of limp. He does not look great. We want to get this kid seen right away. His work of breathing, look at his sternum, the middle of his sternum right there. He is pulling in using those accessory muscles. This is a bad sign, guys. When that sternum is hitting that spine, get this kid back right away to your resuscitation room. And then the last thing is the circulation. He's pale. I'm sure if we looked at his feet on this kid too, he's got some modeling and just looks like crap. Please get this kid back right away. He is suddenly your sickest kid in the department. It doesn't matter. Don't mess around with vitals or anything out in triage. Get this kid back. So those are all three kind of examples. Hopefully that kind of helps you understand a little bit more with the PAT. This is a quick, easy tool to determine whether your kid is sick or not sick. This is very easy across the room. It should be split-second decisions. You should not be taking any sort of time to actually put your hands on the patient. You should be able to look across the room and be like, hey, that kid needs to get back right now. Or that kid's running around the room. I've had that. They go running around all over the waiting room, little terrors, and just totally fine. But they still need to be seen. The parents brought them in, but they can wait, especially if you've got other kids. The other thing too that I get a lot of is make sure you pull the blankets off the car seats. Don't let those kids go sit down until you actually see them. Because I've had them where they come in and they're completely blue and the parents won't say anything because they see the big line. They feel bad waiting. But please expose your kids and actually lay eyes on them. It is super difficult, especially in the wintertime, because it's like, yes, you want to keep them warm, but also you want to see if you're having any sort of cyanosis or retractions, and you can't do a PAT without actually laying eyes on them. Hopefully this helps. If it did, let me know. Give me a like, give me a thumbs up, and then subscribe. I'm going to be putting out more videos here as well. Hopefully this will help you so that way you can feel more confident as a nurse, especially if you're a nurse in an adult world and you do not like kids, because I get it. I love kids. I don't like adults. So hopefully there's some videos that'll help me with the adults that come in every once in a while into my hospital. But yeah, give me a thumbs up if you like it. And then let me know in the comments if there's any specific videos you'd like to see. Have a great day.